So I've looked at the whole range of human experience from birth to death, because I've worked in obstetrics and I've worked in palliative care and everything else in between. The modern medical paradigm in practice separates mind from the body, and it separates the individual from the environment. So when you look at that there's an epidemic of asthma right now in North America, more and more kids are being diagnosed with it, it's all about, or largely about, the increasing stress in our society. So it's a cultural manifestation, and this is completely missing in medical practice. If you look at Black Americans are more likely to get prostate cancer and more likely to die of it, and not because of lack of medical care. But maybe there's something about being a minority in this particular culture that is so highly stressful that it deranges the immune system. If you look at the asthmatic Afro-American woman, is that asthma a manifestation of her own pathology? Or is it reflecting a social malaise? Which means the emotion, whatever you experienced, probably suppressed rage or shame, whatever you experienced, actually affects the physiology of your lungs. Medicine is very interesting that way. If you go to a dermatologist with an inflamed skin, what kind of cream are they going to give you? Anybody know? Steroid cream, right. If you go to a rheumatologist with an inflamed joint, what medication are they going to give you? Steroid very often. If you go to a lung specialist with asthma, what kind of inhaler are you going to get? Steroid. If you go to a gastroenterologist with inflamed intestines, what kind of medication are you going to get? Steroids. No. What are steroids? They're copies of cortisol. What is cortisol? It's a stress hormone. We're treating everything with stress hormones. Maybe it should occur to us that stress has something to do with the onset of these conditions. The fundamental problem is capitalism, or I should say materialism. As long as research is driven by the profits of pharmaceutical companies, what's going to drive the education of physicians except the profit motive of pharmaceutical companies? I mean, it's just obvious.